My name is Andrea Reid. I am the Assistant Commissioner for Prevention Services at the New York City Department of Homeless Services. I'm here with my colleague, Jaclyn Moore. We're going to talk to you a little bit about homeless services and our innovative technology tool that we've put online. It's been my absolute pleasure being here with you all the last 2 days. I am so pleased. I spent 28 years in child welfare, and so I remember Casebook in 2010. And I'm just so pleased to hear the wellness language that's being used across the continuum. So, okay. All right, so New York City Department of Homeless Services is one of the largest organizations of its kind. We have 2,000 plus employees. We have $1 billion plus operational budget. And we contract with over 150 providers that have 300 programs across the continuum, from prevention to shelter for families with children, adult singles, and all the way to prevention service providing aftercare wraparound support for families and individuals that transition out of the homeless system. So, New York City Department of Homeless Services, under this administration, we are enjoying an unprecedented relationship with our system partners. Our mayor has, laid the ground rules that he is on board with making sure that we strengthen and improve the system. And so one of the first things that our commissioner did in his first year was to go on a number of listening tours, and he spoke to folks who were in shelter, folks who had transitioned out of the shelter, stakeholders that have been doing this work together, and he put together what we call our operational plan. And this plan is to help guide our work going forward for the next 3 years. And so when they released the plan, the title of the plan is Guiding Our Journey Home. And home was significant in that over and over and over, as we talked to stakeholders, they talked about, being homeless is not just about not having some place to sleep. It's not just about shelter, but it's really about having a home. And that a home provided connection, it provided support, and it's a foundation for communities. In addition to that, we also developed our vision statement. We wanted to make sure that every employee that you talk to, they can say how their tasks contribute to our vision. And that vision is reducing homelessness and improving lives. We also set out our core values, and I just wanted to go through them for you a little bit. So our core values is around excellence, and this is providing the highest quality services to all our clients. It's about compassion, providing services with empathy. It's about hope, and it's to inspire and encourage all clients to achieve their goals. It's about integrity of the work, to provide services to client with reliability and consistency, and also resilience, to provide strength and support to the clients in the face of diversity. We also identified our 5 priority goals. And this is sort of the lens and the framework that we're using for our work going forward. And at the forefront is prevention. Now, Jaclyn's going to talk to you a little bit more about our prevention tool going forward and how we've deepened our touch. But really, prevention, we provide comprehensive services to combat the many drivers of homelessness. A quick example I wanted to share with you, we have been sharing data with our education system for many, many years, and just recently, we had access to data that family shares. When they enroll their kids in school, they identify whether they're living in vulnerable housing situation. And so we're able to proactively reach out to those families and offer assistance so that they don't show up at the shelter door. We know that around the summer months when schools are out, many families show up in our shelter system. So we're proactively addressing that. The second goal is outreach. And so 24/7, every day of the week, we are out and we provide street outreach services to individuals who are on the street, above ground, and underground. Our second goal is shelter. And basically, what we want to do is to make sure that we improve in the physical plant and the social programming for shelter families who are in shelters. I know we've been talking about all the other sort of intervening variables that we say in social work, and you call them interoperability factors. But one of the things that we wanted to do is to advance the educational, goals of not just the children who are school age, but their parents. And so in every family shelters, we are developing libraries. And we also have a partnership with a local college where we're able to help families pursue associate degrees. We'll be celebrating 7 of our graduates next weekend. We also have graduates, about 50 graduates from high school who are on their way to college, and we'll also be celebrating them and providing laptops to help them on their education journey. The other goal is housing permanency. Now, we want to make sure that when families transition out of shelter, they have a full array of wraparound services. And so we have not had rental assistance program for many years. We now have rental assistance program. We have priority access to public housing, including Section 8. Since this administration, we have moved out almost 4,000 households to permanency. Yeah, wow, we say. Yeah, thank you. The fifth goal that I wanted to talk to you about is organizational excellence. And when I was looking at the training tool, I was thinking, we did something like that with a training tool to help workers self-select out if this is not the type of work that they want to do. But basically, what we think about when we think about organizational excellence is that we want to make sure that our staff have the best possible tools and opportunities and supervision so that they can do their work. We want optimal results. We've also now instituted a quality improvement tool. And so if you're familiar with CompStat, the New York Police Department developed, and then we in New York City went to ChildStat, and so now for homeless services we have HomeStat, and basically statting. And basically what we do is we bring all the stakeholders of a case, the provider, the workers that have worked on the case, and we walk through the case from the day that the family entered the system till they transitioned out of the system or wherever they are in the status of the case. And what we really want is for the workers to be able to tell the story of that family. And then we look for gaps and deficiencies and successes so we can celebrate those and then identify programming to support the ones that are not in place. For the first time, the Homeless Services is looking to develop a training academy, and so we're looking at practices around the globe to see how we can inform that, and so we're pretty excited about that. Just a little bit about our system. So, we serve one of the largest population of at-risk households in the United States. Currently, we have about 56,000 individuals in shelter. 11,000 of those are families with children. 23,000 are children under 18. And so we talk about educational goals, and you think about a child who goes to school and don't know where they're going to sleep the next day, or don't have a home to go home to, or don't know where their next meal is coming from. The learning is definitely impaired at that point. And so we want to make sure we get all these families to permanency. The average length of stay for a family, a person in shelter is 412 days. Well, we think 1 day is too many. And that's why we're doing so much to sort of deepen our prevention touch. I'm just going to talk to you a little bit about our prevention slide, and I'm going to turn it over to my colleagues. So in 2004, we implemented our home-based programming, and we have programs in 23 high-needs community throughout the city where families or individuals can walk in if they're at risk of homelessness. We provide financial counseling, short-term emergency funding, rental assistance, employment services, legal advocacy, and connections to other community resources. And this prevention program is supported by our partners. We have our human resources provider on site so that for folks who need cash assistance benefits, SNAP assistance benefits, Medicaid benefits, the actual program is on site. And we're also co-located in 5 of those sites throughout the city as well. And so, the challenge is always, how do you do more with less, as one of my colleagues said earlier, and how do we target resources so that services are more effective? So we kind of put this into sort of 3 different buckets. And so what we know that our caseworker need in order to do their job well is quick and easy access to information. We want data that is simple to understand. We want to make sure that the ability to assess and prioritize folks who are at risk is available, and we want better outreach strategies. We also want to automate our business processes and productivity tool. Now, we have a lot of systems in place in New York City, but we certainly can improve. So at this point, I'm going to turn it over to Jaclyn to talk with you a little bit about our tool and how we have deepened our prevention touch in the field. Thank you.
Good afternoon, everyone. And once again, thank you for inviting us. We're so pleased to be able to share some of the work that we're doing in New York City. And so I'm going to try to seamlessly transition the conversation into some of the work that we're doing, which includes some of the rental assistance programs and how we have enhanced some of the services in the community, as well as how the city has looked to technology to inform our practice. And when I talk about outreach today, I'm going to be talking about it in the context of our homelessness prevention program, Homebase. They conduct a lot of street outreach to promote the program, promote the availability of resources, to allocate resources appropriately. So as I move forward in the conversation and I say outreach, it's sort of that real sort of promoting resources at the ground level in the community. So in addition to sort of the rental assistance programs that we have to help households that are currently in shelter transition out into stable housing, the city has made tremendous efforts in strengthening the availability of resources in the community. We really understand that the resources and tools that our service providers have to be comprehensive enough to combat a housing crisis, to really be able to resolve a housing crisis so acute that could lead to shelter entry. The city, with that said, the city has invested largely in a lot of rental arrears, emergency arrears programs, and we've also looked at sort of our safety net rental assistance programs and redesigned them so they're a little bit more marketable in the current rental market, as well as expanding the client eligibility so that we're able in the community, when we identify someone who's at risk, that we're able to fight that risk with providing some form of affordable housing moving forward. As Andrea had mentioned, there's several leading factors for homelessness. The two leading factors, the most, are eviction and domestic violence. She also highlighted how there's a reoccurring theme with a lot of households that currently live in shelter. I think it's over 58% of the households that are in shelter had a shelter history previously. And so it's, leaving the community and going to shelter almost is the first response whenever they're experiencing a housing crisis. We also know anecdotally from the field that most folks aren't aware of the resources that are available to them. And they think shelter is where you go to access those services. So, with that said, we've been doing a lot with trying, as part of the operational plan, trying to do sort of an in-reach service model where, as folks are starting to transition out into the community, connecting them to those community-based resources while they're still in shelter, as opposed to hunting them down after shelter to promote the service availability. And so we're doing a lot of initiatives on that front, and we've also implemented a evidence-based program called Home to Stay that uses the critical time intervention service model, working with households that are episodic shelter users that are currently in shelter, helping them locate suitable housing, and then connecting them to the social service supports in the community. It's not so much about giving them a subsidy, but it's also making their apartment a home, making their community a home. And so the service providers really work on helping to integrate the client into their community that they're being moved to. And then lastly, in terms of sort of a high-level eviction, the city's been doing a lot of work in expanding their anti-eviction legal service contracts, as well as working with the various housing court within the boroughs of New York City to sort of really streamline how services are and clients being referred to those services. So as Andrea mentioned, and very quickly, at the forefront of the city's homelessness prevention effort is Homebase. We've doubled the program's funding, which has allowed us to open up 9 additional offices. We've increased our capacity to 20,000. Previously, it was 10,000, so we doubled the number of cases that we can serve. And most importantly, we've been doing a lot of work on strengthening government collaboration. We can't do it alone. We need our agency and our government partners there at the table with us. We're working very closely with our TANF agencies, so close that we have them co-located at many of the community-based offices at Homebase. And we're also at their centers as well as clients go and apply for different subsidies and benefits. And then, as Andrea mentioned, we're working really closely with the Department of Education and our New York Public Housing Authority to really streamline and referrals from those agencies to the programs to prevent vulnerable families from returning to shelter. So very quickly, just sort of the landscape, I'm going to read out a few stats about our little city of New York. We have a population of 8.4. 21.2% of that falls below the poverty rate. 56% of renters are paying more than a third of their income towards rent and utilities. The city has a vacancy rate of 3.45. Anything below 5% sort of is considered a housing emergency. And we see over 200,000 housing court eviction filings a year. So, the city, there's a lot of need in our city. With any homelessness prevention program, effectiveness hinges on the ability to target households that would enter shelter but for social services, sort of thinking about how to allocate limited resources to those most in need. The city is great. We collect all this information and data. The Department of Homeless Services has a really robust case management system that tracks a family that has entered shelter or is seeking services in the community, to families that individuals that are on the street homeless. So the vision was to get data in the hands of the outreach workers, get data into the hands of the field, those who are actually providing the services. So we wanted a tool that centralized data and information. It had to be quickly accessible from anywhere at any point in time. It had to be easily understandable, and then also we really wanted a system that sort of displayed information in a map view base. And then with the visualizing the data and information in a way where the service providers can identify high-risk locations within the communities that they serve. And then also, because that kind of information really assists in the planning of outreach efforts and promoting the program. And then lastly, we were looking for a system that would help automate some of our manual business processes and aggregate data from multiple sources into one place. And so this right here is sort of an example of the application as it's being used today by the home-based caseworkers. The information that's being displayed here, which is, I'm not sure how well you can see it, but the green tiles indicate eviction filings in that location. And then it's also laid over with information about shelter use or interaction. So meaning they've recently applied for shelter, they were recently found ineligible for shelter, or they've recently exited shelter. And so bringing in this data from multiple points helps the program identify areas of the community to concentrate their efforts. This right here is just an example of how the data is segregated by the caseworkers' service areas. Some of the functionality that exists here is that the caseworker could look up areas by region, by neighborhood, by specific address. And then here is how sort of we're taking it to a more macro level, and we're looking and trying to identify hotspots. And so the area that the red dot indicates where all these data points, evictions and interaction with the shelter system sort of come together and prioritize you of where in sort of the borough right here, the borough of Brooklyn, like where we should prioritize our public awareness campaigns, where the workers should go and canvass the streets, knock on doors, talk to the churches, talk to the food pantries, whatever necessary to really promote and the availability of these homelessness prevention services, so that folks go there before they apply for shelter. There's maybe something we could do, especially with the rich service packages that we're trying to provide them. And then this screen just shows a little bit of the functionality. So the user could get in and sort of look at street views or bird eye views of the neighborhood, sort of get the lay of the land before they go out and hit the street. And then it also allows the user to pull up individual case records that are plotted on the map. And so in this little area box right here provides a little bit more client level data. This horrible slide is what we used to get. And so this is the eviction filing that we get from the New York Court Administration. And so it comes in this really antiquated format. A lot of smart people get together and try to manipulate it into an Excel file, and then which we would send this Excel file over to the providers, and they would try to look at it and figure out trends and try to identify their own hotspots. And so from the provider's perspective, I was out there last week, and they were saying that just this alone, sorting through the data in Excel format, was like a quarter of one staff person's time each month as they got the file. And that's just at one office, at one program. So lastly, just to wrap it up, the tool has allowed the field to automate a lot of these business processes, right? And which in turn allows us to spend more time with the clients, and that's the point. And we're in the early stages of utilizing this application, but already it has transformed how the field approaches outreach and sort of the conversations that are going on. We're hoping that through using this tool, we're able to allocate limited resources better, in order to reduce homelessness in New York City. So, thank you.
Very, very, very cool. And I really want to thank you very much. One question. It's got to be a really hot question. Could you go back to your slide with where all the dots are and everything, and little boxes? I mean, this is pretty hot, folks. And I would suggest that you make sure, this is great stuff that you're doing there. And really, yeah.
How long for the innovation? How long from start to finish?
Well, after we put the plan together and sort of integrated the feedback from the users, it took about 4 months to actually, from project start date to go live date.
That's great.
Pretty amazing, right? What a change. I mean, you guys should be very proud of what you've accomplished.
Thank you.